Hi everybody, it's Kathy from Real Life Health Coaching here, and today we're speaking with Julia. Oh, I've forgotten it already now. Julia Rudakova,
Rudakova, yeah, it's the one.
who is a naturopath. So welcome, Julia, and I'd love to know more about you and why you decided to become a naturopath.
Oh, thanks, Kathy. It's lovely to chat to you today. And I grew up in Russia, and I've always been fascinated with natural medicines. So it's very, very popular over there. You can go to a medical doctor and get a prescription for acupuncture sessions, for example. And my family has always used herbs and homeopathics for different ailments. So I grew up in this environment, and naturally I absorbed all the knowledge from a very young age. And that ignited my passion for natural medicine. And then later I got qualified as an aromatherapist and a massage therapist. And naturopathy was a very organic progression from that. So that's my passion, lifetime passion from a very young age. And of course, I have my own health journey and how I came to naturopathy. You can read about it on my website. It's Happy Star Natural Wellbeing. Only later, when my younger son, it was about 7 years ago, was diagnosed with asthma, that I started to look into the Buteyko method. That's what we're going to talk about today, right?
Yes.
So, and I became a qualified Buteyko practitioner as well. So unfortunately, my son didn't respond well to conventional treatment for asthma. It just didn't do anything for him. And I started my research. So I did whatever I could with herbs and homeopathics, and they were great. But I stumbled upon this method of breathing, and I found that it is amazing for so many conditions, not only asthma. It's sleep apnea, it's various chronic diseases of our modern time. And I just fell in love with it, and it's easy. And what I like about it the most is that it puts you in control. So you learn it, and it's with you for the rest of your life. Yeah, so this is the brilliant thing about it. And so I practice in Melbourne, and I do Skype sessions or Zoom sessions, and I have 2 clinic locations in Apnoea and in South Croydon.
So would you like to elaborate a little bit more about what you mean by this breathing method?
Yes. So the Buteyko breathing method is all about nasal breathing, about diaphragmatic breathing involving your diaphragm as opposed to chest muscles, because what we notice nowadays that modern people breathe a lot with their chest muscles. So the chest is moving a lot instead of the tummy. So it's retraining you to breathe diaphragmatically and through the nose. And it's all about light breathing.
Okay.
So that's just, in general, how you can describe it.
Cool. Now you mentioned sleep apnea. So could you tell us a little bit more about sleep apnea and what sleep apnea is and what causes sleep apnea?
Yeah, so as you know, there are 3 types of sleep apnea. There is upper airway resistance syndrome, and that's mostly the causes are the naturally narrowed airways. Yeah. So, and then we have obstructive sleep apnea. So that's the mechanical problems that when the tongue and the soft palate blocks the airways. And then we have so-called central sleep apnea. That's to do with disorders in the brain when the brain doesn't send signals to the muscles which are responsible for breathing. So the most common is, of course, the obstructive sleep apnea.
Okay.
So, and the causes for this are various. So it can be medication, it can be alcohol intake, it can be excessive weight. But behind all this, we have hyperventilation.
Yes.
Yeah. So by hyperventilation, I mean breathing in much more air than we need. So it's mouth breathing. Yeah. Because if you compare the whole, your open mouth and your nostrils, which one is bigger?
Definitely.
Yeah.
Yes.
So.
Yeah.
So
and you use this breathing method in treating sleep apnea, you said?
Yes, absolutely. So conventionally, what is available at the moment, if you go to a doctor and you get diagnosed with sleep apnea, so you have your CPAP machine, yeah, so that's a mask. So it's a device that blows air into your nose, yeah, to create positive air pressure, airflow. So, and you have various dental devices, mouth guard-like devices to move forward the lower jaw to open up the airways again, yeah? Because if we go back to the original definition, it's about the collapse, about the tongue moving backwards, yeah, the soft palate moving backwards and blocking the airways so you don't breathe at all. And so those devices can be really good. They're very expensive, the mouth devices, so that can be off-putting for a lot of people to start with. CPAP machines, they have their drawbacks.
Oh, definitely.
So they're uncomfortable, they're noisy, and they're not really treating.
No.
Yeah, they continue.
No.
So, and Buteyko breathing is all about correcting the position of the tongue in the mouth.
Right.
Yeah.
Okay.
Retraining, re-educating your brain to start breathing lightly. So what I like to tell people is the analogy of a paper straw. With this wide collapsible paper straw, if you try to inhale a lot of air through the straw, the walls of the straw will collapse. Yep. Yeah. If you start to breathe lightly through the straw, it's going to be fine. Yeah, it won't collapse. So that's the same with our airway.
Sure, that makes sense.
And why it's important to do a few sessions of breathing and be very, very diligent. So the Buteyko breathing method is all about diligence, really. It's not easy to start with, but you basically retrain the brain. So there are receptors in the brain that are very comfortable with your current carbon dioxide levels in the blood, right? And to retrain it, you need to consistently do certain exercises. So that's what it's all about.
Okay. And how many sessions would someone generally need to correct or improve their sleep apnea with this method?
So the very, very minimum that I recommend is 4 sessions. That's the block that I have. And of course, it depends on what's going on with the person, what other health conditions the person has, right? So maybe it's an allergy that's somewhere in the background and that creates nasal congestions. So that needs to be addressed, yeah? So the person will struggle to breathe through the nose big time. So we work with that. Or, the weight loss is big as well for breathing. So, did you want to ask anything else about that?
No, I was just going to say, what sort of results do you generally find they get with it?
So if we talk about sleep apnea, it's basically people stop using their CPAP machines. They get their sleep back, and they get rid of all the symptoms that go with the sleep apnea, and that's, memory issues, learning issues, lack of focus at work or at school. Children also suffer from sleep apnea, believe it or not. And snoring. Snoring is huge, isn't it?
Well, it affects more than the person too, the snoring.
Yeah, it affects relationship, And what I wanted to just maybe add today is what you can do without seeing me to try and start correcting this. Yeah, so I always recommend sleeping on the side, yeah, as opposed to the back or the tummy. So that's the most appropriate position so that the tongue doesn't fall backwards. And do not try to eliminate tobacco and alcohol from your diet when you work with this. And milk products, dairy is not good just before bed because it creates this layer of mucus in your mouth and throat. So things like that, and even raising, we have, if you go to a bed store, they have amazing beds nowadays when you can raise the head of the bed so that you're slightly upright. So that helps too, I think. So just, generally discussing the diet with someone like you, for example, like I'm in awe of your work, you're amazing. So doing this and eliminating foods that irritate your system, so that will help with anything like sleep apnea as well. So eating large meals at night, so I would recommend to swap. It's called meal reversal, eating slightly more in the morning and less before bed, so because nowadays we eat maybe a cup of coffee, tiny breakfast, and a big dinner just an hour or two before bed.
Yeah, definitely. So, I mean, definitely eating before bed is not going to be great for our sleep routine and anything. It's just amazing how much our sleep can affect our quality of life, like you said, our relationships, our ability to perform during the day. And sleep apnea, like a lot of conditions, is on the rise. So this is an amazing thing. I mean, I cannot imagine those that use the CPAP machine, how they even sleep with them. I imagine you get all tangled up in it when you're turning over, and it must really affect your quality of life.
Absolutely. They do improve. They have maskless machine now.
Yeah, good. Okay.
But still, it's the noise and the air that is that's flowing into you. It actually dries the airways. So we do need a certain level of carbon dioxide in the blood to correct everything. And just CPAP just doesn't deliver that.
No. Well, it sounds like an amazing technique that you're using with your patients. So I hope that the people in the group have found this interesting, and anybody that's experiencing sleep apnea, Julia would be more than happy to have you contact her. I'll put her details of her website with the video. So if you want any more information about how Julia might be able to help you with your sleep apnea, then I definitely would recommend that you contact her. So thank you so much for joining us today, Julia. It's been a really interesting discussion to have with you and learn more about what you do.
Oh, my pleasure, Kathy. Anytime.
Is there anything else you'd like to add before we finish? Anything else that might interest the people in the group?
Just before we go, I encourage you to notice how you breathe, to see if you wake up with a sore throat or dry mouth, or you have dribbles in your pillowcase, because most often than not, sleep apnea goes undiagnosed for quite a lot of time, so, and just notice if your breathing is noisy or not, so when you're next to a person, sometimes you can hear how heavily the person is breathing. So just these signs and symptoms, they're good indicators that something is not quite right, so that the blood chemistry is not right because of that. So,
they're really great tips, and it's a really good starting point for people to really examine that part of their health and like if people are struggling in their sleep, that's contributing to their stress levels, which is contributing to their ability to lose weight. So all these pieces of the puzzle all join together. So thank you again, and it's been really great talking to you today.
Thanks, Kathy. Bye.
Bye.